name is Grace. I'm a mere third-year medical student from the University of Buckingham, and I've chucked myself in the deep end and done an international conference. So I'm doing this with an orthopedic surgeon who works in London. So what are osteoporotic spinal compression fractures? So osteoporosis is a disease characterized by low bone density and is common in postmenopausal women and people of older age. And in this pathology, there is increased risk of fracture due to the low bone density, and this can cause a vertebral compression fracture. So you can see on the MRI what it would look like, and when you're doing your investigations, what to look out for. So this can often result in kyphosis and obviously pain and stiffness, etc. So the objective is to investigate the effectiveness of surgical versus non-surgical management for osteoporotic spinal compression fractures. So spinal compression fractures have a huge burden on the NHS and associated with high levels of pain, decreased mobility, changes in posture, neuropathic pain. And it's important to manage these patients because it can be very debilitating and obviously very painful, and we want to reduce that as much as possible. So surgical management usually involves a vertebroplasty or a kyphoplasty, which I will go into, and you could consider decompression of the spinal cord if it's affected. Conservative management involves best rest, analgesias, specialist pain care, bracing, physiotherapy. So vertebroplasty is the picture on the top, and it involves placing bone cement into the vertebral body to basically give it its structure. And the kyphoplasty has a balloon and blows it up first, and that reduces your kyphosis, and then bone cement is placed. So in England and Wales, 18,000 of the presenting fractures each year are a result of osteoporosis, and it's estimated that 25% of women above 50 years old experience at least one vertebral compression fracture. And patient survival rate is 53%, so obviously has a huge impact, even though they may have many comorbidities also contributing. So these are the incident rates, and you can see that vertebral compression fractures are very prevalent and therefore need to be managed. So the methods was a literature review with PubMed and Google Scholar, and 3 papers were analysed for an in-text full review. So the results: conservative management, so your non-operative management, according to studies, is poorly tolerated, and there's an increase in uncontrolled back pain and increased progression of kyphotic abnormality, as well as decrease in height. And conservative management has increased risk of the development of another or secondary vertebral compression fracture. So surgical management, it was more effective in reducing pain and disability, according to the Roland Morris disability score, compared to conservative management. And it was showed to have an improvement in the quality of life. There was no significant difference in the function between vertebroplasty and kyphoplasty, but obviously one restores posture and height. So the surgical intervention demonstrating 90% of patients reporting pain relief and increased mobility within 24 hours. And then reporting from clinicians, 95% had improvements. So kyphoplasty allows for the significantly more rapid improvement in the quality of life, pain and mobility. So obviously there's obviously risks that come with the surgery, which also need to be considered. So neurological injury is one that can take place, increased stiffness, and obviously if you have one vertebral body which is much harder than the others, which has still got osteoporotic changes, they can also have secondary vertebral compression fractures. And embolization can occur, but is rare, but leads to other complications. And then surgical management also requires analgesia, which can lead to complications which come with any general anesthesia. So conclusions overall is, if the patient is fit for surgery, a broad conclusion can be drawn that this is more effective to reduce pain, disability. Also, your posture and your height can be restored. According to a study, greater clarification is needed to for the guidelines within clinicians to be able to make these decisions. But I think it's a very patient-centered decision that you have to make. So clinical judgment needs to be used as well as the guidelines. And here are my references. Thank you.